Yes, it's time for another Quackcast. The skeptical and sarcastic evaluations of quacks, frauds, and charlatans. Got it wrong again. Supplements, complementary, and alternative medicine. Scams. This podcast is December 2009, and I would like to take this opportunity to wish my listeners a non-denominational generic seasonal greeting. It's podcast number 38. I'm going to cover mesotherapy. Brought to you, as always, as a side project of Pussware LLC, where you'll find the Persiflager's Annotated Compendium of Infectious Disease, Facts, Opinion, and Dogma, your uber-hyperlinked electronic guide to infectious disease. Now, as Thomas Jefferson said, ridicule is the only weapon that can be used against unintelligible propositions. Ideas must be distinct before reason can act upon them. That Tom sure know how to turn a phrase. References are available on the website. Now, my ravenous ego was briefly sated of late because I won the podcast and health category at the Podcast Awards. I would like to thank everybody who voted for me. I certainly did deserve to win. It's nice to know that a loudmouth smartass with bad production values and a voice which one listener likened to a serial killer can still pull off an award. And I'd also like to congratulate the Skeptic's Guide to the Universe. I've been carrying those guys on my back all these years. It's nice that they finally did something on their own. So anyway, on to mesotherapy. I keep looking for a weight loss technique that does not involve work and willpower on my part. Asahi was a non-starter, see the last podcast, and I have found a more direct way to rid yourself of 10 pounds of ugly, unwanted fat. Cut off your head. Sorry, an oldie, but a goodie. As I was reading the infectious disease literature, I came across a series of patients who had infections after mesotherapy. Mesotherapy has a legit-sounding name, but I had never heard of it, and the article I was reading was vague as to exactly what is done, except to put atypical mycobacteria into the skin of patients. So I started looking into mesotherapy and found it is, amongst other things, an alleged form of weight loss. Rather than have the weight loss go away from metabolism, you can inject it away. Maybe I can get rid of the seasonal turkey and gravy with mesotherapy. What is mesotherapy? It is from the Greek meso for more made up crap, and the term therapy for gotta make it sound scientific. It is, and I quote, a minimally invasive technique that consists of intra or subcutaneous injections of variable mixtures of natural plant extracts, homeopathic agents, pharmaceuticals, vitamins, and other bioactive substances in microscopic quantities through dermal multipunctures. End quote. Meso, in this case, actually refers to middle. While it sounds impressive, it is injections into the middle layer of the skin. It is minimally invasive, as the needles are only 3 millimeters long. Mesotherapy has a curious origin, oddly familiar to those of us who wander the fringes of medicine. In 1952, a French physician, Michel Pistor, like my French accent, treated a man with asthma with IV Procaine, which is an anesthetic. And while it did not help the patient's asthma, it did improve the patient's hearing. D.D. Palmer be praised. Dr. Pistor, at that point, decided to inject the Procaine superficially around the ear. And while it did not restore the hearing in other patients, kind of like chiropractic that way, it did have some patients with improvement in their temporal mandibular joint pain, their eczema, and their tinnitus, which is ringing in the ears. Of course, this therapy was a panacea. It was not limited to treating hearing loss, but was soon used for treating systemic problems with local superficial injection. Dr. Pistor, in typical French modesty, said, quote, "The action on tissue originating from the mesoderm is so extensive that these treatments deserve the global name of mesotherapy." End quote. Actually, I'm quite a Francophile, and I probably should be embarrassed to use such a crappy French accent. And a new branch of medicine was discovered, at least in France. By the way, the French Academy of Medicine recognized mesotherapy as a specialty of medicine in 1987. It is popular in Europe, and it is popular in South America. But so is homeopathy, and at one time, fascism. Now, I know Goodwin's Law and all, but back when I was a fellow, one of the drug reps was detailing one of my attendings about a new drug, and he said to the attending, and this drug is popular in Europe. And my attending looked at them and said, so was Hitler for a while, and turned and walked away. That's a funny story. And it may invoke Godwin's Law, but so be it. Back to mesotherapy. First, the cure of deafness. Now, imaginary connections all over the body that can be altered with local and superficial injections. I sometimes wonder if the think globally, act locally originated in medical scams. The list of diseases treated with mesotherapy is extensive. Are you ready for this? I know it's not quite like John Hodgman reading hobo names, and I apologize for the lack of a banjo, but I cannot afford John Colton. So maybe you can just fast forward here, but here they come. Allergies, arthritis, asthma, carpal tunnel syndrome, cellulitis, chronic fatigue, constipation, degenerative disc disease, depression, fibromyalgia, gout, headache, hearing loss, hemorrhoids, hepatitis, herpetic neuralgia, immune system deficiencies, insomnia, irritable bowel syndrome, low back pain, lymphedema, obesity, bone spurs, peripheral vascular disease, prostatitis. I hate to think where they put the needles there. Reflex sympathetic dystrophy, sports injuries, substance abuse, TMJ, tinnitus, and vertigo. That's a good list. Now, such a large number of diseases should require equally large number of substances to be injected with mesotherapy. And they include, but are not limited to, here we go again. Maybe I should try this to Gilbert and Sullivan. It's no. I'll just make the list. These are some of the things they inject: T3, T4 thyroid, isoproterenol, aminophylline, pentoxifylline, L-carnitine, L-arginine, the L you say, hyaluronidase, collagenase, yohimbine, myhimbine, lympomyosat, coenzyme cofactors, dimethylethylamine, Gerovital, whatever the hell that is, glutathione, vitamin A, alpha-lipoic acid, vitamin C, procaine, lidocaine, ginkgo biloba, something I've never heard of called mellitus, see adenosine monophosphate, multivitamins, phosphatidylcholine, trace minerals, carbon dioxide, and homeopathic preparations. Of course, homeopathic preparations. When you want to make sure that you will accomplish nothing, give the therapy that never gives. Now, mesotherapists choose their injectables for all their alleged effects. For example, injecting a nonsteroidal anti-inflammatory for its anti-inflammatory effects. Or artichoke, this is French after all, for circulatory stimulation. Now, they do not mention if the artichoke is injected with butter or mayonnaise to ease the flow through the needle. I would prefer it done with garlic butter for myself. And often multiple substances are mixed together based on the experience of the mesotherapist rather than God forbid, data. And this cocktail or melange is injected into the skin. There is only the experience of the mesotherapist to decide what to inject and for what purpose. There is almost no data in the literature to support mesotherapy, much less a given agent used in the injection. Since the drugs that are used are approved for other indications, the mesotherapist is using the drugs off-label, and so it is considered acceptable practice within the narrow eyes of the law. There are less than a dozen articles in the European literature to support the use of mesotherapy for medical conditions such as pain and musculoskeletal conditions, and they have the same rigor and outcome as acupuncture studies. For any real disease with objective outcomes, there is essentially no medical literature to support the use of mesotherapy. To become a mesotherapist, you have to take a course. You have to have probably extreme gullibility and a full bank account. In the U.S., mesotherapy courses are often combined with Botox injection courses and other cellulite and fat-burning procedures, and the form of mesotherapy for treating other medical diseases is not, as of yet, common in the United States. A mesotherapy course costs $1,200. One website, however, points out that at $400 a visit for 6 to 15 visits, it will not take long to recoup cost. There is an American Board of Aesthetic Mesotherapy that was founded to, quote, protect consumers from unskilled practitioners, end quote. Their website, on the topic of how mesotherapy works, says, quote, the medications used in mesoplasty cause shrinkage of fat cells by dissolving fat. The fat is then excreted through the urine and the bowels. Mesotherapy can also improve the appearance of cellulite, fibrous bands that tint the skin. Cellulite is reduced by reducing the size of the trapped fat cells. Mesoplasty also enhances hair regrowth, God I wish, by improving circulation of the scalp and providing needed nutrition to hair follicles. The effect of mesoplasty can be enhanced by eliminating toxins from the diet and maintaining a healthy program of exercise, end quote. That's what they say at the American Board of Aesthetic Mesotherapy. Some things really do not require editorial comment. In the U.S., mesotherapy is used primarily for cosmetic changes and body sculpting, but also to, quote, dissolve fat, unquote, and treat cellulite. Its efficacy is debated as evidenced by one review entitled Cosmetic Mesotherapy, Between Scientific Evidence, Science Fiction, and Lucrative Business. The plastic surgery literature often states that mesotherapy is not the same as using injections of phosphatidylcholine and deoxycholate to remove superficial fat, for which there is some supporting literature. These compounds are injected deep into fat, unlike mesotherapy. The histopathology after phosphatidylcholine and deoxycholate injections demonstrates an inflammatory response with fat necrosis, and there may also be some fat necrosis from traditional mesotherapy products as well. Of course, if you inject a foreign substance into tissues, there should be an inflammatory response to the substance, and as a side effect, the fat would be killed. Collateral damage, I believe the military calls it. It is how, for example, BCG works for bladder cancer. Injections of live mycobacteria into the bladder set up an intense granulomatous response in the bladder wall to the AFB, and as a consequence, the bladder cancer is killed. So part of determining if mesotherapy can lyse fat is in part defining what constitutes mesotherapy, what kind of fat you are trying to eradicate, and with what you are injecting. It depends on what the meaning of is. One patient, for example, with congenital large symmetrical fat collections, I think I have that in my head, was treated with good cosmetic effect with injections of phosphatidylcholine, but many would not consider that mesotherapy since the phosphatidylcholine was injected deep into the fat. Whether similar or other injections are beneficial for cellulite or superficial fat depositions cannot be determined. The data to date is minimal, and what is out there suggests it is without efficacy. There is one study which demonstrated, quote, 20 women were enrolled in this prospective case-controlled study over a 12-week period. The authors injected a mixed solution, aminophylline, biflomidil, and lidocaine, into the superficial dermis of the medial aspect of one thigh weekly using a mechanical delivery gun. There was no treatment to the other thigh. The change in the fat level was evaluated by measuring the girth of the thighs and by computed tomographic scanning. They CAT scanned them. The lipid profiles were checked to determine the effect of mesotherapy on lipid metabolism, and questionnaires were used to determine the satisfaction rate of patients. Results: the loss of thigh girth on the treated side was not significantly different from the untreated side. The CAT scan showed no statistically significant difference in the cross-sectional area or thickness of the fat layer in each group. There was no statistically significant change in the lipid profiles. A questionnaire asking about the effect of mesotherapy indicated poor patient satisfaction. Conclusion: mesotherapy is not an effective alternative treatment modality for body contouring. End quote. And that's the only study out there. Unfortunately, mesotherapy is worthless for the turkey-induced muffin top. It can run thousands of dollars, and to judge from sites not promoting mesotherapy, it is both painful and useless. Go to realself.com and search for mesotherapy. People pay a lot of money, and most are not pleased with the results, as evidenced on realself.com. $4,000 in Boston. 1 year on, I still have lumpy thighs. $2,500 spent in Dallas, Texas. Worst thing I ever did. $2,500 spent in Melbourne, Florida. Mesotherapy. A costly, painful waste. $3,000 in Bakersfield. Scarred for life. $2,000 in South Africa. Results will never make up for the bad experience I have had. $195 in Atlanta, Georgia. Painful but worth it. $2,300 in Oregon. What the heck did I get myself into? $3,000 spent in Lenore City, Tennessee. Not worth it. $100. It's always cheaper in Redondo Beach. Mesotherapy made me look worse. And on, and on, and on. Most people spent thousands of dollars, and it didn't work. Many who use scams seem to be do-it-yourselfers, as evidenced by the make-your-own colloidal silver contraptions, and in the classic article on who uses alternative therapies, more people used acupuncture than actually visited an acupuncturist. But I would advise against home mesotherapy using lipase, as one patient did. Mesotherapy is not FDA approved, but since the products are, except I suppose for the artichoke, which I guess is food, does the FDA approve of vegetables? The FDA has approved these medications, and they are used off-label by mesotherapists. While efficacy is almost certainly zero and cost is variable, there are well-described complications. There are numerous outbreak reports of infections with atypical mycobacteria, cousins of TB, that cause long-term scarring. Not surprisingly, some of the outbreaks are due in part to practitioners who do not use, sterile technique. This from the CDC, quote, 14 patients reported breaches in safe injection practices by the practitioner, including failure to practice hand hygiene, failure to prepare the skin with an antiseptic. I'm shocked. Failure to wipe vials with alcohol before injection, and failure to wear gloves. Of 11 patients who could recall, all reported the use of a new needle. However, 9 patients reported use of a multi-dose vial. Patients reported being told that their injection contained various substances, including extracts of artichoke, thuja, liquid graphites, and procaine. With the exception of the procaine, none of the substances reported by the patients have been approved for subcutaneous injection by the FDA. Unquote. I'm so surprised that an alternative practitioner would not be using optimal sterile technique. Now, there was a recent outbreak in the November Clinical Infectious Diseases, quote, 16 patients were infected after mesotherapy injections performed by the same physician. All patients presented with painful, erythematous, draining subcutaneous nodules at the injection site. All patients were treated with surgical drainage. Microbiologic examinations performed on specimens that were obtained before and after the surgical procedure. They found AFB. Mycobacterium chelonae was identified in 11 patients, and Mycobacterium fredericksburgensis was identified in 2 patients. End quote. They all required long durations of multiple antibiotics and were all cured. This is not uncommon with mesotherapy and is a commonly reported side effect. Mesotherapy is also associated with case reports of other odd reactions, including thyrotoxicosis, hyperthyroidism from injecting thyroid into the skin, Aseptic arthritis, those 3mm needles evidently go deeper than one would suppose, and a wide variety of local skin reactions. Kel surprise, you're sticking artichoke extract into the skin, you're gonna get a reaction. I wonder if I were to give a mesotherapy injection with acai juice. Nah, I suppose I will stick with diet and exercise. Crap. So that's it. The references are on the website. This is copyright 2009, the Creative Commons license. Don't forget to continue to feed my ravenous ego by going onto iTunes and writing me a glowing review. The music is by my son when he was 12, improvising on the guitar. And that's it. Thanks as always for listening. And again, thank you for voting for me for the podcast awards. It's nice to know that someone's listening.